Bill and Penny have been married for 60 years, Penny proposing to Bill after just 3 weeks. Otto was a wedding gift. Their love for each other and German Shepherds started early. Throughout their marriage, they've averaged at least a German Shepherd per decade, Belle being their 6th. Today, Bill and Penny stay active, playing tennis and walking their beloved Belle.
The next thing I remember is letting her into the gate of the dog park.
So I came back from playing tennis, and the phone rings.
The next thing I remember, I hear my husband Bill yelling, "Penny, are you okay?
Penny, where are you?
Penny, where are you? What's wrong? Is everything okay?"
The hospital. Where? Emergency room. Click. So I ran over to the emergency room, and there she was.
The next thing I remember is waking up from a coma about a week later.
So Mrs. Allyn presented to the emergency room after sustaining a fall at the dog park. And upon arrival in the emergency room, she was found to have multiple rib fractures and a bruise on her brain that we refer to as a subdural hematoma.
When we went in, there's all this activity going on all over, and everybody was there. And it's just amazing with all that confusion, all the crisis going on, that the care can be delivered as well as it was.
So the emergency room diagnosed, stabilized, and then called a team of people in to help further care for her into the hospital.
Penny she was just covered with tubes and feeding tubes and drainage tubes and this and that. The only part of her body that wasn't covered with tubes of one type or the other were her feet. She loved to have her feet massaged. I was massaging her feet day after day, massaging her feet. And one day I was massaging her feet and she went like this. The toes bent. I started crying.
To have a renovated emergency room is very important because in Mrs. Allyn's case, when she fell at the dog park, for a younger individual, that may result in not nearly the number of injuries she had. With Mrs. Allyn's maturity and her age, she sustained rib fractures, the hematoma on her brain, and we need to have the facilities to be able to take care of the changing demographics of our community, but also just the growing community. We have outgrown our emergency room.
Yeah, I've been on the board of NCH for many years, and our biggest problem always, biggest complaint always was the emergency room. Not because of the people, the ER people did wonderful jobs, but it was just so tiny.
I'm so glad Mrs. Allyn chose the downtown Baker Emergency Department for her care. We already have great staff and great patient care, but what we're really looking for is to expand our facility so that we can make that care even better. The downtown ER is the hub of care. It's where more than 70% of patients start their hospital experience, and going forward, we're looking to improve that even further.
A lot of people will never, like me, think they would ever need an emergency room. We need a bigger size, especially in the season. It's just jammed, and they try so hard to help everybody quickly, but sometimes that's not possible. And we really need more room.
Now, I want to tell you, when she did wake up, I said, "Peg, what have you been dreaming of?" She said, "I've been dreaming of being on the beach surrounded by German Shepherds." So some things don't change.